In this episode, we're breaking down the truth about AMH and what your doctor isn't telling you about what it actually means for your fertility. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? In this episode, you'll learn what AMH is actually measuring and what it doesn't tell you about your fertility, why AMH is often overemphasized in conventional fertility care, and what matters more than AMH for your fertility success. Today, we're talking about a number that has caused more panic, fear, and pressured fertility decisions than almost any other lab, and that is AMH. If you've ever been told that your AMH is low, time is running out, or that IVF is your only option, this episode is for you because the truth about AMH is very different from how it is portrayed in your doctor's office. So let's talk about what AMH is actually measuring. AMH, or anti-Müllerian hormone, is produced by small follicles in the ovaries. It reflects the quantity of recruitable follicles and how the ovaries are responding to signaling. It does not measure egg quality, your ability to ovulate, your ability to conceive naturally, or your ability to carry a healthy pregnancy. Yet many women are told or led to believe otherwise. So just a reminder, AMH is just a tool. It is not a fertility verdict, okay? So why does conventional fertility care use AMH so much and make it seem like it's this black and white lab? AMH is often used because it helps clinics predict what your response to ovarian stimulation would be. It helps determine medication dosing, and it also helps estimate egg retrieval numbers. Now, this is helpful for IVF, but it doesn't tell the full fertility story. The problem arises when AMH is used as a standalone predictor of pregnancy, which it is not. So women are rarely told and shocked and surprised that AMH can fluctuate. It can fluctuate from hour to hour, day to day, week to week, month to month. It is a ever-moving number. AMH does not reflect your egg health, and pregnancy can happen. You just need one healthy egg, okay? Low AMH does not necessarily mean low fertility potential. So here are some of the most common things I want anyone listening to this episode to know. Women with low AMH can and do conceive naturally. I was told in my early 20s that I had low AMH and I conceived naturally at 29 and again I was 35 technically, but pretty close to turning 36. Egg quality matters far more than egg quantity, and ovulation quality and implantation receptivity matter far more than your AMH level. AMH does not account for hormone signaling, your mitochondrial health, inflammation, metabolic function, nervous system regulation, all of which directly impact. Now, there are some reasons that your AMH may be coming up as low on the lab test, okay? So let's talk about those. Low AMH is often treated as a fixed reality. In many cases, it can actually be influenced by modifiable factors. That means that you can make intentional changes to improve your AMH. And we have seen it in our clients, okay? So number one is chronic stress and nervous system dysregulation. High cortisol suppresses ovarian signaling. When your body is in survival mode, reproductive signaling is down-regulated, including AMH expression. Number two, inflammation and autoimmune activity. Inflammation can really interfere with ovarian communication and follicle recruitment. This is common in women with thyroid autoimmunity, gut dysfunction, or chronic immune activation. That is why with every single client I take on, we are absolutely running a full thyroid panel and we are running a comprehensive stool test to see if there is any gut dysfunction going on. Number 3, nutrient depletion and mitochondrial stress. Your eggs are mitochondrial dense cells, so the health of your mitochondria matters dramatically. So things like nutrient deficiencies, toxin exposure, and oxidative stress all impact ovarian signaling, independent of your age. And this brings me back to that comprehensive stool testing, because if you do have certain things going on in the gut, that can cause nutrient depletion. Okay, it's all connected. Number 4, birth control history. And honestly, this was probably, actually not probably, this was one of my biggest issues because I was on birth control for over 13 years before we tried to conceive. Hormonal contraception can temporarily suppress AMH expression, especially when labs are drawn too soon after stopping birth control. Did you know birth control can actually shrink your ovaries? So this makes sense, of course, if you have a history of birth control use. So let's talk about what matters more than your AMH level. Instead of obsessing over AMH alone, we also need to assess ovulation consistency and quality. So that is why tracking your cycle is so important. And no, using LH strips and cycle tracking apps is not enough. We need to be tracking your BBT, or even like the at-home hormone tracking devices are great for this. Your luteal phase length, your progesterone levels, your estrogen patterns, thyroid function, metabolic health, blood sugar stabilization, inflammation, and gut health. When these systems are supported, your fertility outcomes can absolutely improve regardless of your AMH, okay? Yet addressing all of these things will likely increase your AMH, but again, we're more focused on egg quality than quantity, because it only takes one healthy egg. So let's recap what we talked about today. We unpacked the truth about AMH and why this number alone should never define your fertility future. AMH reflects ovarian signaling and follicle quantity, not your egg quality, implantation ability, or your capacity to conceive naturally. And when we shift the focus away from fear and towards supporting ovulation quality, hormone balance, metabolic health, inflammation, and nervous system regulation, fertility outcomes change, even in women who are told their AMH was too low to ever conceive. Remember, AMH is just data, not your destiny, and your body deserves more than just a one number explanation. So, AMH is just a guide to support you and give us some intel on what's possibly going on. Your body is not running out of time. It's just asking for the right support. And when we address the root causes that can suppress fertility and thus your AMH levels, many women are able to conceive on their own terms, even being told otherwise. I've seen it so many times in my clients where they are in their 40s, where they have low AMH, and they were told either IVF was their only option or that they needed to get an egg donor. We start working together, we start addressing their individual root causes, and then they're conceiving naturally within just a few months. It's wild. So never let anyone put limitations on your fertility, especially from one lab number, okay? So if you're tired of guessing and being told what you can and cannot do in terms of getting pregnant, and you want to know exactly how to increase your fertility now, grab your free fertility strategy call. The link is in the show notes, and we'll build out your personalized step-by-step plan. Thank you so much for listening. I hope you have a beautiful day, and I'll see you on our next episode, which you don't want to miss because we're actually going to be talking about a nutrient that impacts your AMH. I'll see you there. Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.